Hello, and thank you for taking the time to view this presentation. This presentation is going to cover the results of the evaluation that was done for the Closing the Digital Divide in Timiskaming project. But before we get into that, let's do a quick backgrounder on the issues this project was addressing. There is a digital divide in Timiskaming, a gap between people who have access to internet-connected devices and those who do not. The gap between people who have access to devices has been highlighted with the changes to many services in response to the COVID-19 pandemic. The Closing the Digital Divide project was launched to address the demand for internet-connected devices to access essential services. Devices were distributed and connectivity plans were provided. We had enough funding to continue providing postpaid internet connections to clients up until March 31st of 2022. Additionally, after the project ended, clients were able to keep their devices permanently. So that background information brings us to the framework of the outcome evaluation, more specifically the goal and objectives around which the project was to be measured. Now, this evaluation was designed to help with implementation decisions, to support accountability for the use of funds, as well as increase stakeholder understanding of the reach and impact of the project, and to inform any potential future efforts in this area. With that being said, the main goal of this project was to provide improved access to devices and technology for older adults and people experiencing financial hardship. And to assess progress towards this goal, we had 5 objectives. These objectives were: 1, to determine how many clients qualify as either an older adult or someone with financial hardship; 2, to determine to what extent the devices and services supported clients; 3, to determine what barriers and facilitators clients experienced over the course of the project; 4, to determine what unintended impacts, both positive and negative, were experienced; and 5, to predict what barriers and facilitators to digital inclusion clients will face after the end of the project. So to determine if we did or didn't reach these objectives, we had several evaluation questions tied to each of these. So for the results of this evaluation, what we'll do is we'll go through objective by objective, sharing the findings and the feedback on our initial interpretations that we gathered from referral partners as part of a validation presentation. So we had 2 main target populations with this project, which were older adults and people who experience financial hardship. As the first objective was to determine how many of the project clients qualified as belonging to either of these groups, we included relevant questions on both the application and the client survey. So from the applications we received, we were able to determine that 47% of project applicants were 50 years of age or older, and that 83% of project applicants made less than $25,000 per year. Now, as for the client survey responses, we saw that 53% of respondents were 58 years of age or older, and that 73% of respondents made less than $25,000 per year. As we were able to collect relevant demographic information from the application data as well as from the client survey data, we determined that this objective was met. Additionally, when we asked referral partners to provide their thoughts on our determination for this objective during a validation presentation, the general consensus was agreement around this objective. So with that being said, let's move on to objective 2. That was to determine to what extent the devices and services provided over the course of the project supported clients. So to determine this, we asked referral partners to rank questions relating to how they thought the project supported their clients by level of agreement, and we asked clients to choose options about how their devices and services were able to support them, and we also included an open response option for clients to provide additional feedback. Referral partners, broadly speaking, had a positive outlook on the project, with over 80% either strongly agreeing or agreeing that it supported clients in accessing internet-connected devices, internet connectivity supports, continued learning opportunities, health services and programs, including mental health services, and over 60% of referral partners strongly agreed or agreed that the project supported clients in securing or maintaining a job or employment, accessing health and well-being information, and applying for financial support. Hence, also noted the supportive nature of the devices and services, with over 70% of clients surveyed noting that the devices were either extremely or very helpful for accessing devices, internet services, virtual social meetings, online learning opportunities, and health and well-being information. However, clients did not find the devices to be as supportive for other areas. For instance, accessing healthcare, only 58% of clients found the support to be extremely or very helpful for this. For applying for financial supports, only 49% of clients found the supports to be extremely or very helpful. And for securing work or keeping a job, only 33% of clients found the supports to be extremely or very helpful for this. Now, for that last point, it's worth noting that many clients were either of retirement age or had been referred to us by ODSP, and this is reflected by the high number of non-applicable responses to this option. Also ask clients an open response question regarding how the devices and services supported them. From this, we saw a number of themes emerge, including social connections, continued education, accessing news, general information, and supportive services, important communications, such as supporting clients in accessing emergency services or getting calls from healthcare providers, increased job performance. There was also some negative commentary on the equipment provided. Personal entertainment was another theme that we saw. There was a broad other theme, which just represented general positive statements regarding the project and technology. And there was a mental health response, which indicated that the supports provided were beneficial for client mental health. So, given that we were able to identify multiple ways in which these devices and services help to support community members, both from the perspective of referral partners and clients, we considered this objective to be a success. Now, when we discussed these findings with referral partners, a majority of attendees agreed with these findings. And when we were discussing these findings in that validation presentation, one of the referral partners noted that a reason that there may have been a notable difference in client and referral partner responses to this objective may be that some clients may not have had the required expertise or understanding in how to use their devices in some of the ways suggested, such as accessing healthcare or looking for jobs. So, with that being said, let's move on to objective 3. The third objective was to determine what unintended impacts, both positive and negative, were experienced over the course of the project. And to assess this objective, we asked clients an open question and a closed question to assess how the project impacted them. First, we asked clients a select all that apply question regarding negative impacts they may have experienced. From this, we heard that the most prominent negative impact was confusion trying to operate their device, with over 50% of respondents to this question experiencing this issue. Crime was the second most prominent issue, with just over 20% of respondents experiencing at least one of these incidents. The same proportions of clients noted that they spent too much time using their device or experienced unease when using online services. Actual or perceived loss of privacy, which was a less commonly reported unintended impact for project clients at 7%. And interestingly, 0% of client survey responses noted theft as an unintended impact. Now, outside of the client survey, there were a number of reports of device theft, so even though this unintended impact is underreported in the client survey, it's important to remember that it was an issue that was experienced by some project clients. Next, we asked clients a neutral open response question about other unintended impacts, whether positive or negative, that they experienced that were not captured by the check all that apply question above. So from this question, some themes emerged, including positive sentiments, which were just general responses which indicated that clients experienced only or mostly positive impacts of the project. We also had difficulty with the device setup as another theme. There was a mention of computer software and hardware issues that were experienced. There were some privacy concerns that were mentioned. There was also, again, a reduction in physical exercise that was a concern, and there are also affordability concerns that were mentioned here. So, from the information gathered from the client outcome evaluation survey, we determined that we were only partially successful in this objective. The reason for this is that while we were able to identify a number of negative unintended impacts, we unfortunately determined relatively few positive unintended impacts. When we discussed this determination with referral partners, the majority had a neutral opinion on this objective determination. And during our discussion of this objective, one of the referral partners shared their concerns with how the survey was not able to capture responses from clients who had their devices stolen. We took this feedback into account and made sure to recognize this in the discussion section of their final report. Now on to objective 4, which was to determine what barriers and facilitators were experienced over the course of the project. And to measure this objective, we asked both referral partners and clients what their thoughts were on various project barriers and facilitators. So we first asked referral partners to describe any factors that they felt contributed to project success. From this question, some themes emerged, including efficient, easy, and timely processes, which were comments on the accessibility, acceptance rate, and speed of service for the project. We also had opportunities given to the clients and our community, which included things like increased client independence, security, enhanced communication, and things along those lines. We also had community partner involvement, which was positive commentary on the importance of partner teamwork, the importance of referral partners' roles in this project, and things along those lines. And then we also had a mention of continued need for similar projects addressing digital equity in the community. So next, we asked referral partners to describe factors that they felt limited the project. From these responses, there were some themes that emerged, including a not applicable theme where referral partners explicitly stated that they had no feedback for this particular question. The next most common theme was budget and funding limitations, which were responses relating to lack of funding and the impact that this had on the project. There was also challenges of project sunsetting, which included issues of clients affording data plans, the need for longer application periods, and general commentary on the need for additional projects or programs to address the affordability portion of the digital divide. After that, we also had the need for additional support and follow-up for clients and referral partners in regard to digital literacy. After that, we also had mentions of unanticipated issues such as usage charges and lost, stolen, broken, or undelivered devices. And beyond that, we also had concerns regarding evaluation follow-up. Now, as for what clients thought about this objective, we asked them about their level of agreement with a predetermined list of facilitators and barriers. For the most part, these responses were rather positive, with 80% or more of respondents either strongly agreeing or agreeing that they thought the application process was easy, that the device choices met their needs, that the time to receive their devices was reasonable, that they were treated with dignity and respect when they needed info about the project, and that they were supported in the language of their choice. Now, it's worth noting that there were responses indicating that some barriers could be addressed better. Of note, 75% or more of clients strongly agreed that they received enough information to participate in the project or that they received timely information throughout the project. Additionally, only slightly less than half of clients strongly agreed that the data plan they received met their usage needs. However, there was a large portion of respondents who selected the not applicable response option for this statement. So, based on the responses that we heard from the perspectives of both clients and referral partners, and the number of barriers and facilitators that were identified as a result, we determined this evaluation objective to be successful. And when we discussed our determination of this objective with referral partners, the majority were in agreement with our determination. Now, a notable talking point that did come up during our discussion was the ethics of providing continuing services and then withdrawing these services down the line once people have come to depend on them. This was interesting as this was a concern that was also expressed internally early on in the project, and that is what led us to take a lot of mitigation steps and journey as much supportive material as we could for community members to help them access existing connectivity supports. So the final objective was to predict what barriers and facilitators to digital inclusion participants will face beyond the end of the project. And to measure this objective, we asked clients what their thoughts were on various barriers and facilitators to digital inclusion that they may encounter in the future. We initially asked clients to identify their intention of continuing to use the device they received once the project had ended, and we saw that a large majority of clients indicated that they would do so. Next, clients were asked an open question about the barriers to digital inclusion they may face in the future. A number of themes emerged, including the most common theme was a not applicable theme, and this again represents client responses that predicted no challenges once the digital divide project was ended. After that, we had affordability and cost concerns, such as challenges relating to the continuing cost required for data or internet plans. Beyond that, we also had continued challenges with internet connection and availability, which were general concerns expressed by clients regarding internet connectivity, but with no specific cited reasons. We also had positive comments on supportive resources provided and the project in general. And after that, we also had a theme of lack of support, which were responses noting the future difficulties clients will face in accessing and using online technology due to a lack of support. Beyond that, we also have service provider choice, which were challenges imposed by limitations of internet service providers due to living in rural areas. Beyond that, we also have device accessibility concerns, which were difficulties experienced with devices due to accessibility limitations, like difficulty seeing text on a screen with people who have eyesight challenges. Now, we also asked clients to rank the importance of facilitators to digital inclusion after the project had ended. And from this question, clients noted that the most important future facilitator to digital inclusion is affordable, quality internet services at home, as over 90% of clients ranked this facilitator as being either extremely or very important. Now, the second most important facilitator identified was public places with free Wi-Fi, with over 70% of clients ranking this facilitator as either extremely or very important. Workshops on digital device usage were not ranked as highly as the other facilitators, and one possible reason for this is that only a certain subpopulation of people accessing this project, those who are new to using technology or who have low levels of digital literacy, would benefit from it, whereas others would likely find that these workshops may not be very applicable to themselves. So, from the feedback gathered from clients, we were able to understand several barriers and facilitators affecting client digital inclusion. While this is not an all-inclusive list of potential barriers and facilitators, it does offer some insight into what clients predict to be the most pressing issues for future digital inclusion. As such, this objective can be considered a success. And when discussing this determination with referral partners, there was notably some mixed feedback, with the majority of referral partners having a neutral opinion on this finding. Specifically, referral partners expressed some unease around the wording used when posing the evaluation questions relating to this objective, although other referral partners did acknowledge that this is an inherent challenge in designing surveys of this nature. This was a notable finding from the validation presentation, as we did take steps during the design process to involve referral partners in the review and approval of the survey designs, and this may suggest that even more involved co-design of future surveys may be a consideration for future evaluations. Now, another important component to discuss is some of the limitations of this evaluation. Limitations are important to explicitly discuss in reporting, both from the perspective of being clear about how to interpret and apply the results of this evaluation, as well as highlighting design considerations for future evaluations. So, with that being said, what were some of the limitations for this evaluation? Well, let's start with the obvious one. So with COVID-19, the limitations posed by the COVID-19 pandemic resulted in logistical challenges with project applications and with project feedback options. For instance, we weren't able to hold in-person focus groups with clients to get more detailed feedback. Additionally, there was also a loss to follow-up, which was a major concern pre-evaluation, and this concern proved to be quite valid with the challenges we experienced in contacting clients for survey follow-up. This also resulted in some delays to finishing the outcome evaluation itself, as the deadline for the client surveys had to be extended a couple times to improve the response rate. Beyond that, convenient sampling does impose major limitations on the results of the outcome evaluation. Specifically, it limits the applicability of the results to other jurisdictions, and the results should not be interpreted as being representative of broader populations. One more limitation I'd like to mention is that the evaluation occurred while clients were still receiving connectivity packages from the project, which may have somewhat limited the ability to accurately gather data on participant expectations for when the project ended. Overall, the results of this evaluation indicated that the project was successful in addressing the digital divide and reducing the severity of this issue during the COVID-19 pandemic. Now, through this project, we were able to provide devices and services to over 400 unique clients and an estimated 700 household members in total. Referral partners and clients have expressed again and again how much this project has meant to them. With that being said, we're very well aware that this project was a Band-Aid solution relying on one-time funding, and that future collaborative work among local organizations will still be needed to bridge the digital divide. Thank you very much for taking the time to listen to this session. It's greatly appreciated. If you're interested in viewing the results of this evaluation in more detail, then you're more than welcome to take a look into the final evaluation report available on the Timiskaming Health Unit website.